I'm Bobby Huynh, and let's queer up health. U.S.-Philippines Health Pact raises LGBTQ plus HIV care concerns. According to the State Department, a joint declaration signed this month outlines closer bilateral cooperation with a focus on transitioning the Philippines towards greater self-reliance in health systems. The framework, introduced under the Trump-Vance administration America First Global Health Strategy, includes co-funding, workforce development, health data systems, and emergency preparedness. In practice, quote-unquote, self-reliance signals reduced dependence on foreign aid. In the Philippines, however, LGBTQ-focused HIV programs have historically relied on international funding and technical support, including from the U.S. The Philippines is currently facing one of the fastest-growing HIV epidemics in Asia-Pacific region, with new infections rising by about 543% between 2010 and 2023. Key populations, including men who have sex with men and transgender women, account for roughly 92% of new cases. Desi Andrew Ching, president of HIV and AIDS Support House, said the agreement offers promise but hinges on implementation. Ching wants that the funding may not reach grassroots LGBTQ organizations that communities trust. I believe Mr. Ching. I think it's probably the problem is that, one, without direct implementation or direct dispensation of aid, a lot of these grassroots organizations are likely to be ignored. Philippines is a very religious country, and there are many regions that are very deeply Catholic or deeply Muslim. And from the cultural standpoint, homophobia, well, thanks to Christianity and being dominant in Philippines. Remember, Philippines was a long time Spanish colony, and they came under, and that became an American colony after the U.S.-Spanish War in the 1800s.
I don't remember the exact year, but yes.
But the whole idea, so for me, I'm not entirely sure if dispensing aid directly to the Filipino government is going to end up in the hands of people who are truly in need of it.
Isn't the Philippine government like kind of crazy right wing? Am I off on that?
Duarte, the last one, who was actually facing trial in The Hague for human rights abuses, is right wing, and he also is notoriously user. But the current president, I believe, is Marcos, who is the son of the previous president, who was exiled after a revolution, who was accused of billions in grift.
Oh, that's delightful.
His mother is Imelda Marcos, the famous collector of shoes, who ousted, who fled to Hawaii with Marcos the
So it definitely sounds like the sort of government that you'd think would want to have a relationship with Donald Trump and the Make America Healthier Again grifters.
Yes, and also, I mean, with whoever is in charge of our global health efforts, I don't know if we are going down the rabbit hole of conspiracies or for fake therapies or outright just unscientific approaches to
We don't even need to do it. It's just like looking at, like, of course, a country like the Philippines is going to need aid from other countries to help with HIV implementation, because we, the United States, that develops most of these really good drugs, charge an insane amount of money on the world market for them. And that is a huge problem that we still continue to do. And I'm glad to see that the U.S. provides some financial support. But yes, I'm horrified and scared that we're going to tell them to not do anything specifically for queer people.
Well, I think, again, we have a pendulum swing here. The United States has supported the world in so many things. Healthcare, human rights, we can go down the list. I think to our detriment in a way, and the reason why I'm going to say that is I do believe that as a world power, we should be helping our fellow communities and countries to help them grow, to support themselves. I do believe that there should be a timeline, a plan, let us help you build your systems, let us put the things in place, let's do all these things. Unfortunately, we have seen time and time again that does not happen. Either we don't go in with the right intentions, we don't go in with the smart people to do these things, and all we do is keep paying and paying and paying. And at what point, and then unfortunately, then you get an administration like we have now and go, okay, we're done paying. Like, so they go from this to this.
Yes. We're not always, so like the Philippines is known as a place where we take a lot, specifically nurses. A lot of people from the Philippines are trained to be nurses in the Philippines. They don't stay, they come here. Yes. We literally drain them of their healthcare workers.
I'm not saying what I'm.
No, I know what you're saying. I'm saying that we think of that
we should be helping these, but I also do firmly believe that, as a country, we shouldn't just be handing out, and I've always said this, we shouldn't just be handing out things, we should educate, we should help, we should give them the tools that they need to start helping themselves, so that way we can pull back a little.
That's a good
But
point.
the thing is, though, the institutions that exist on the ground over there, and I'm not casting aspersions because I do not know how, the situation that is going on there, but suffice it to say, I don't think the local institutions are adequate. I mean, we need, and also if you are really worried that money will be lost or stolen, we can always fund people like the organization like the Gates Foundation, which has worked a lot in Africa for HIV AIDS reduction.
But you look. Let's talk about. We went. You go in and you teach them how to farm. You teach them how to. That will feed them for a much longer time than just dropping off food at their back door.
Well, that's the difference between the Chinese and the American approaches, or a Western approach of nonprofits. China is notice that Philippines, despite its proximity to China, is not is not seeking help, because it doesn't work that way. China will build you a port, help you, say that it will improve your exports to boost your economy, and then back charge you for, overburdening you with debt as Sri Lanka.
But as you said, the Philippines, it's a former U.S. colony. It has very close ties to the United States. That's why they work with us.
We still have bases in the United States, don't we?
Yeah, of course. The Philippines. We have a very tight relationship with the Philippines. It goes back over 100 years. Like, I'm not shocked that they would talk to us and not China. And also, no offense to China, but they don't have the really fancy HIV meds. We're the ones that built that. And you can't teach a small country to develop new drugs. You have to not charge them an arm and a leg to build their own factory.
Cuba has managed.
You can do both.
Cuba has managed to train doctors. They don't develop all the health science themselves.
And that would be a wonderful initiative, certainly not under this current administration.
Well, yeah, that's the bigger point,
but, being in HR for over 25 years, that they'd have some kind of exchange where people could come over with the understanding they're going to go back and take the best of the best in the Philippines, who have those pharmaceutical potentials and technological and business skills, and translate that into helping themselves.
Bring them over here, train them, give them the education, and then go, okay, now go back and implement this. There are ways to train, and there are ways to educate, and there are ways to help somebody help themselves.
Yes.
We tend not to do that. Because if we do, then we no longer have a puppet string and leverage.
That might quite be true. Well, there is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by sharing them and subscribing to Queer News Tonight.